In your favorite chair, your legs could be quietly forming blood clots, and you'd have absolutely no idea until it was too late. Last week, a 72-year-old patient came into my office. I'll call her Margaret. She hadn't walked properly in 6 months because of severe knee pain. But here's what shocked me. As a vascular surgeon, her leg circulation had become so slow that she was already developing early signs of blood clots. Just from sitting in her chair all day, every single day. I'm Dr. Daniel Thompson, a vascular surgeon, and in 26 years of treating circulation problems, I have seen this scenario play out more times than I can count. Seniors who can't walk are at a 300% higher risk of developing dangerous, life-threatening blood clots. That is not a small number. That is a crisis hiding in plain sight in living rooms, recliners, and kitchen chairs all across America. But today, I'm going to show you 5 simple chair exercises that save Margaret's circulation, helped prevent blood clots from forming, and can be done by virtually anyone, even if you have severe knee pain, mobility issues, or haven't been active in months. If you or someone you love struggles with walking but spends hours sitting every day, this video could literally save your legs or your life. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Let me paint you a picture of what happens in American households every single day. Your mom, your grandmother, your father, they settle into their favorite chair in the morning. They watch the news, read the paper, maybe chat on the phone. Hours go by. When they finally get up to use the bathroom or grab a snack, their legs feel heavy, swollen, sometimes numb, like they're filled with concrete. Most families brush it off. They say, well, they're getting older. That's just what happens. But this is not just the normal process of aging. It could be your circulation crying out for help and nobody is listening. Here is the medical reality that most people don't know, and that I think every senior and every adult child of a senior needs to understand. When you sit for hours at a stretch, blood begins to pull in your lower legs. Your calf muscles, what we in the medical field call the second heart, stop working. Blood flow slows down dramatically. And here is the dangerous part. This creates the perfect biological conditions for blood clots to form. We're talking about deep vein thrombosis, pulmonary embolism, conditions that can be fatal. They don't always give you a warning. They don't always announce themselves with big obvious symptoms. They can develop quietly, and by the time someone notices, the situation can be critical. In this country, joint pain, knee arthritis, hip problems, back pain prevents millions of older adults from walking regularly. And that means millions of American seniors are unknowingly putting themselves at serious risk every single day simply by doing what their doctors told them to do. Rest, stay off their feet, avoid the pain. But here's the good news, and this is what I want you to hold on to. Your calf muscles can still act as your second heart even while you're sitting down. You don't have to walk. You don't have to stand. You don't need special equipment. You just need to know the right movements, and I'm going to teach you exactly what they are right now. Let me tell you more about what happened to Margaret, because her story is one I've seen repeated in my practice over and over again. 6 months before she came to see me, she could barely stand for 5 minutes at a time. Severe arthritis in both knees. Her previous doctor had told her, stop walking, it's going to make your pain worse. So, she did exactly that. She stopped moving almost entirely. She was spending 12 to 14 hours a day sitting in her recliner. She genuinely thought she was doing the right thing, protecting her joints, following doctor's orders, being sensible. But when I examined her legs, I found early signs of serious circulation problems, swelling in the lower legs and ankles, skin changes that suggested compromised blood flow. Her calf muscles had weakened significantly from months of complete disuse. The pump that was supposed to be moving blood back up toward her heart had essentially gone quiet. That's when I taught her these 5 chair exercises. Simple, gentle movements that activate the calf muscle pump without putting any stress on the knees or joints. No standing required, no walking required, no special equipment, just a chair and the willingness to move for about 10 minutes a day. Today, 4 months after she started doing these exercises consistently, her leg swelling is gone. Her circulation has measurably improved, her energy levels are noticeably better, and most importantly, she avoided the dangerous complications that were beginning to develop. The secret to her turnaround, these exercises turn your calf muscles back into powerful circulation pumps, even while you're sitting completely still in a chair. And I'm going to teach them to you right now. Exercise number 1, the ankle pump. This is your circulation starter, and it is the single most important thing a sedentary senior can do for their leg health. Here's how to do it. Sit comfortably in your chair with your feet flat on the floor. Now simply flex your toes and the front of your foot upward toward your shin, then point them back down toward the floor, up and down, up and down. Here is the medical magic happening with every single repetition. Every time you flex your ankle upward, you are physically squeezing blood out of the veins in your calf. Every time you point it back down, fresh oxygenated blood flows into the tissue. You are manually operating a pump that, when you're sedentary, would otherwise be sitting completely idle. Do this 20 to 30 times. Keep the movement slow and controlled. Keep your heels on the ground. There should be no pain. If you feel discomfort, simply reduce the range of motion. The goal here is gentle activation, not strain, not performance, just movement. Margaret started calling this her TV exercise because she does it every single time she sits down to watch her favorite shows. It's just become part of what. This one simple movement done consistently can improve your leg circulation by 30 to 40% in just 2 minutes. 2 minutes. No equipment, no getting up, just moving your ankles back and forth. Now let me explain why this works so powerfully, because I think once you understand the biology, you'll never skip this exercise again. Your heart pumps blood down to your legs. Gravity actually helps with that part. But when blood needs to travel back from your feet all the way up to your heart, it has to work against gravity. It needs help, and that help comes from your calf muscles. Every time your calf muscles contract, they squeeze the veins in your lower leg and physically push the blood upward back toward the heart. This is why we call the calf muscles the second heart. They are a mechanical pump, but when you sit in a fixed position for hours, especially with your feet flat on the floor and your legs at a 90-degree angle, that pump essentially stops. The blood just sits there, it pools, it becomes sluggish, and when blood becomes too slow and stagnant in your veins, it becomes vulnerable to clotting. These chair exercises restart that second heart. They activate the muscle pump that keeps your blood moving even on the days when walking is simply not possible. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now, let's move on to point number 2. Exercise number 2, seated calf raises. This is your power pump, and it takes things up a notch from the ankle pump. Here's how to do it. Sit with both feet flat on the floor. Now, slowly lift your heels as high as you can, keeping your toes firmly on the ground. At the top, hold the position for 2 full seconds. Feel that squeeze in your calf muscles. That tightening sensation is exactly what you want. Then, slowly, in a controlled way, lower your heels back down to the floor. Up, hold, down. That's 1 repetition. Do this 15 to 20 times. And I want you to actually feel your calf muscles working. If you don't feel them working, slow down even more and really focus on the squeeze at the top. Here's what is happening physiologically. You are creating a powerful, sustained compression that physically pushes the pulled blood from your lower legs back up towards your heart. One of my patients described it perfectly. After doing this exercise, she said she felt an immediate lightness in her legs. That heavy, full feeling started to lift within just a few repetitions. If you currently have swollen ankles, and many seniors do, especially later in the day, this exercise alone done regularly can reduce that swelling by 30 to 40%. Not over weeks or months. You may notice a difference the very same day you start doing it. Exercise number 3, seated marching. This is your circulation booster. And honestly, of all 5 exercises, this one tends to bring the most smiles. Here's how to do it. Sit up tall in your chair. Good posture matters here. Now lift one knee up as high as is comfortable for you. Then lower it back down. Immediately, lift the other knee. Alternate the legs just like you're marching in place while sitting. Left up, lower down, right up, lower down, left, right, left, right. Try to keep a steady, rhythmic pace. Aim for 30 to 60 seconds of continuous marching. It should feel like gentle cardio. A little bit of effort, a little bit of warmth building in the legs, but never pain. Here's what makes this exercise especially powerful. It doesn't just activate your calf muscles, it also engages your hip flexors and your core muscles. Multiple major muscle groups working together creates a much larger circulation boost than any single muscle working in isolation. The blood flow improvement reaches throughout your entire lower body, not just your calves. And here's something I've noticed with patients over the years. When you put on a favorite song and march to the beat, people tend to keep going longer and stick with the habit over time. 1 minute of seated marching can noticeably improve blood flow through your entire lower body. One important form note, try not to sway your upper body side to side as you march. Keep your torso relatively still and let the movement come entirely from your legs. This keeps the exercise focused and also protects your lower back. Now, before I get to the last two exercises, I need to stop and share something that I consider absolutely critical, because as much as these exercises are about prevention, you also need to know the warning signs that require immediate medical attention. Blood clots are often called silent killers, and the reason is exactly that. They can develop without obvious symptoms until they reach a dangerous stage. Here are the warning signs you must know by heart. If you experience sudden pain or swelling in one leg, particularly if it's just one leg, not both, that is a red flag. If you notice sudden redness or unusual warmth in your leg, that is a red flag. If you develop sudden shortness of breath, that is a red flag. If you experience chest pain that gets worse when you take a deep breath, that is a red flag. If any of these things happen, any one of them, do not wait and see. Do not try to sleep it off. Go to the emergency room immediately. Call 911 if needed. These symptoms can indicate a blood clot that is already formed, and time is genuinely of the essence. The exercises in this video are for prevention and for improving overall circulation. They are not a treatment for an existing blood clot. In fact, if someone already has a clot in their leg, vigorous movement of that leg can sometimes dislodge it and cause it to travel, which can be life-threatening. So please consult your doctor before starting any exercise routine, especially if you have had recent surgery, known circulation problems, a history of blood clots, or any heart conditions. With that said, let's continue. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Exercise number 4, ankle circles. This is your flexibility enhancer, and it addresses something that doesn't get nearly enough attention: ankle mobility. Here's how to do it. Lift one foot slightly off the floor, just an inch or two is fine. Now rotate your ankle in a slow, full circle. Make the circles as big and as smooth as you can. Go clockwise first. You should feel a gentle stretch in the ankle joint and into the calf muscle. Complete 10 circles in the clockwise direction. Then reverse and do 10 circles counterclockwise. Lower that foot and do the same thing with the other ankle. 10 clockwise, 10 counterclockwise. This exercise does two important things simultaneously. First, it improves ankle flexibility, which tends to decline significantly with age and inactivity. Many seniors lose ankle range of motion without even realizing it, and that loss affects their balance, their walking gait, and their risk of falling. Second, the multidirectional nature of the movement promotes circulation through all the small vessels and soft tissues surrounding the ankle joint, not just the large veins targeted by the ankle pump. Maintaining ankle flexibility isn't just about circulation. It's directly connected to your ability to walk safely and confidently as you age. This simple exercise helps preserve that ability while simultaneously boosting blood flow. Exercise number 5, seated leg extensions. This is your complete activator, and it brings everything together. Here's how to do it. Sit back in your chair with good posture. Extend one leg out in front of you until it is roughly parallel to the floor. While holding your leg extended, flex your ankle. Point your toes up toward you, then down, just like you did in the ankle pump. Hold the extended position for 3 to 5 seconds, then slowly lower your leg back down. Then do the same thing with the other leg. Perform 10 to 15 repetitions per leg. What makes this exercise so valuable is the scope of muscle engagement. You're activating your quadriceps, the large muscles on the front of the thigh. You're engaging your hamstrings at the back of the thigh. You're working your calf muscles, and you're recruiting your core muscles for stability. It is genuinely a complete lower body workout done entirely from a seated position. It is perfect for people who cannot do traditional standing or walking exercises. The key word with this exercise is controlled. Slow on the way up, hold at the top ankle movement, and slow on the way back down. Don't rush through the repetitions, don't swing the leg. Quality of movement is far more important than speed. 5 slow, controlled repetitions will do more good than 15 sloppy, rushed ones. Together, these 5 exercises take just 8 to 10 minutes from start to finish, but done consistently, they can improve your leg circulation by 50 to 80%. I'm going to give you the full protocol right now, but you may want to take a screenshot or write this down. The chair exercise circulation protocol: ankle pumps, 20 to 30 repetitions. Seated calf raises, 15 to 20 repetitions. Seated marching, 30 to 60 seconds. Ankle circles, 10 in each direction per foot. Seated leg extensions, 10 to 15 per leg. Do this complete routine 2 to 3 times daily. That's all it takes. If you feel pain at any point during any exercise, stop that exercise immediately. If symptoms persist or you're unsure about anything, consult your doctor. This is the chair exercise protocol that has helped so many of my patients begin reclaiming their daily routines, getting up more easily, moving around more freely, feeling less heavy and swollen in the legs without needing surgical intervention. Now, I do want to be clear, these exercises are education and health awareness, not medical advice and not a substitute for professional care. If you have severe circulation problems, a history of blood clots, recent surgery, heart conditions, or any serious health concerns, please consult a vascular surgeon or your primary care physician before beginning this or any exercise program. But for the majority of seniors who are spending long hours seated, who have been told to rest because of joint pain, and who don't realize what that prolonged stillness is doing to their circulation, these exercises are a simple, safe, and genuinely powerful tool. If you found this video helpful, please share it with someone you care about, your parents, your grandparents, a neighbor who spends most of the day in a chair. Poor circulation affects tens of millions of older Americans, and most of them have no idea that something this simple could make such a meaningful difference. If you enjoyed this video, please leave a comment with one. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.